virtual visits allow you to meet with a physician remotely, and it's a tool that's becoming more and more popular. Here with more on telemedicine is Dr. Reena Mehta, pediatrician with Uptown Allergy and Asthma. Hi, thanks for being here.
Good morning, Happy New Year.
Thank you, same to you. What exactly is telemedicine? I haven't heard of this before.
So like you said, it's a virtual visit with your physician where he or she can see you, evaluate, diagnose, and treat you in a remote way. So it's almost like FaceTiming, where basically you would download an app on your smartphone or your computer, which then puts you in a secure video chat with your doctor.
And is it always your doctor, or could it be any doctor that you talk to?
Well, if it's a service that your doctor provides, then you can definitely set up a visit as such. If for some reason your doctor doesn't provide this service, then there are many other companies that do, and they can almost put you in touch with the doctor on demand.
So why is this becoming so popular now?
Well, if you think about it, it's convenient access to medical care. So you may not have time to wait in the waiting room, or you may not have time to take time off of work or school for a simple office visit. So through telemedicine, you could be sitting on your couch, you could be on vacation, and still get quality care.
You actually just gave me a great example when we were talking in the commercial break about one of your patients who was out of the country.
Right, exactly. So let's say you're overseas or you're abroad and something happens and you would rather talk to your own physician who knows your medical history. It is a great way to put you in touch for a simple problem like that, rather than trying to find access, going to urgent care, going to the emergency room for something that may be simple.
Right, and it might not be an emergency where you have to go to an emergency room in another country where you don't know the language or the doctors. You just want to talk to your own doctor. So how does this work with health insurance? Is this sort of thing covered, or is it like you have to pay for the app to download it?
So for health insurance, it's typically state by state. There's state-specific regulations. Fortunately, Louisiana is one of 29 states where telemedicine visits are covered by most insurance carriers, private, Medicare, and Medicaid. So that's lucky. So it's actually treated just like a regular doctor visit. But in fact, actually may be more affordable because there's fewer resources used, so you may expect to pay less for that office visit.
So maybe instead of paying your usual $50 copay, you're paying like $35 or something.
Possibly. You'd have to check with your insurance company, but most you recognize it as a true doctor visit.
So would you say this is as effective at diagnosing problems, speaking to someone via the phone or the computer, as opposed to seeing a doctor in person?
Sure. So I mean, it doesn't work for all office visits, especially those that require procedures. But it is a great way to address simple concerns, maybe the common cold, a rash, medication refills. It's also a great way to schedule a follow-up appointment with your doctor. So let's say to review medical labs or maintain chronic medical conditions. Or let's say you're a new patient. It may be great to triage to see how urgent the condition truly is.
Or perhaps meet a new doctor if you want to kind of test somebody out before you have to commit to going there, filling out all the paperwork, going through all that.
Exactly. So there's many uses for it. It may not be for everything, but it definitely serves a purpose.
So something you definitely think we'll see more and more in the future, telemedicine.
Absolutely.
All right, Dr. Reena Mehta, thank you for your time this morning.
Thank you for having me.